we are not going to let anybody tell us that, AGI is going to solve all of man's problems. And, there are these geniuses working, at these companies that are going to build this like quote unquote AI systems that are just going to hand wave you away, save everything, and everything's going to be solved.
Welcome to Partner Path, a podcast that unpacks the venture capital and growth equity ecosystem from a junior perspective. Young entrepreneurs and investors have already had a massive impact on the industry, having started unicorns and launched billion-dollar funds. We discuss these success stories and more by sharing perspectives and advice from some of the industry's most prominent role models. This podcast expresses our views as of the date published and does not represent the views of and is not endorsed by any company for which we work. Before we get to the episode, Laura and I are excited to announce a partnership with Overlap. Fresh out of Y Combinator's summer batch, Overlap is an AI-driven app that uses large language models to curate the best moments from podcast episodes. Imagine having a smart assistant who reads through every podcast transcript, finds the best parts or parts most relevant to your search, and strings them together to form a new, curated stream of content. That is what Overlap does. I personally use Overlap to explore content on future podcast guests and highly recommend it as another diligence tool for investors. Check out Overlap on the App Store today.
Warm welcome to today's guest, Trey Holterman, co-founder and CEO at Tennr. Trey was an All-American rower at Stanford, where he studied computer science. After spending a year as a software engineer at Strava, Trey launched Tennr with his former teammate, Diego, and former roommate, Tyler. Since going through YC in the winter of 2023, Tennr has gone on to raise over $60 million in venture funding from A16Z, Lightspeed, and other top venture funds. Welcome, Trey.
So excited to be here. Thank you guys for having me. This is like a nice office. It's like a really nice office.
Thank you.
You can't really tell. You got like a nice humble sort of white walled background here.
Quick plug for Notable.
Yeah.
So let's dive into your personal background outside of software, Tennr, healthcare. Let's start with rowing. You're on the rowing team at Stanford, and it's an incredibly grueling sport that requires a ton of discipline. We'd love for you to dig into how rowing has influenced who you are today.
I think it's honestly two things about it. One is that you're quiet for super long periods of time, which I would otherwise never have been probably my entire life. So you're sort of forced to sit there for 2 hours, just like in your own head. So you come up with a lot of ideas. You kind of just start thinking through funny scenarios, funny situations. You have conversations hundreds of times before you actually have them, because you just have that dedicated space where you're just in this like meditative motion that doesn't really vary, which I think people really underestimate what it does for the brain to just be quiet every day for 3 to 4 hours. The other side of things is that you literally get to see your body respond to systems over a really short period of time. And you're like, it's almost a sort of like out of body, I guess, experience to see you're able to produce some output in one period of time. You do all these things to your body, and then you're able to produce a different output some other period of time. And so it definitely is like at a very young age, you get this really nice long-term feedback loop where you have to change something about yourself for months, and then you get this incredible outcome months later. It's not like you do one thing and you push one side and you see the result right the other side. You have to do it over and over, and then you see this outcome. You get this big reward and immense sort of pride that comes from that. And I think everybody that's ever played any sport always draws the exact allegories from their sport or the lessons from their sport into, their work experience. But it's definitely true in rowing, where it's just like the day in and day out is just not that fun, actually, to be honest. Like I'll go back to the office and the day is not going to be a fun, joyous day of hip hopping around. It's going to look a lot more like a training event or a day of training, a day of routine of sort of execution. And then, if we keep doing these things right, you get these moments where you race and you look up and you're like, oh shit, we've come pretty far. We've got a lot better.
It would be great to dig into how do you think your leadership skills being a rower at Stanford has translated into your leadership skills being the founder of Tennr?
There's still never been something more apt to describe like what this experience is like than sort of being the captain of the rowing team, which is like every single day. It's not going to be fun. It's not going to be easy. It's actually going to be like very unenjoyable most days. And I tell people that before we hire them. We tell people that as we're starting. Yeah. And yet you realize like that's what makes it so fun. That's what makes it so exciting, because then I feel like you learn from having a sport in rowing. It's like what really motivates people and what's really exciting to people, and like how to bring people together through the kind of hard stuff. And the right people like get really excited by that. One thing, for us is healthcare is made up of all these little verticals, right? And so there's verticals that you can sort of sell into And, a customer can speak to 20 other customers just like them. You have all the integrations, all the partnerships in the world. We hire the type of people that when we say, hey, we're going to go into a new vertical and, are you willing to do this? You're probably going to lose a lot of money, right? If you're a sales rep, you're like foregoing a lot of like guaranteed commission in verticals that we absolutely are great at. We're the type of people that are super fucking excited by that, which I think is rare, but it's sort of like mostly goes to the like way that we set the stage of like, this is going to be a lot more like rowing than it is like some sport that's fun. I love basketball. Basketball's fun. Like playing basketball's fun.
Yeah.
Playing the game's fun. Practicing's fun. This is not fun.
Yeah.
There's like moments where you get to declare victory and win, and that's incredibly exciting. But by and large, it's just training over and over and over.
What would you say those moments where you pick your head up and are excited about the victory of the race day? Is it customer wins, fundraisers? What would you define that?
Well, at the end of the day, it's all completely arbitrary. And so we sort of have to like decide when those are. I typically actually don't do it around fundraisers, which we've had recently of, I try to stage the fundraise to people as sort of an opportunity to step on the gas pedal a little harder. Maybe you thought we were already at pedal to the metal. Let's go a little bit further, which should feel like a monkey on people's back, if anything. For us, it's a big customer that we've been going after for a while. It's a quarter end where we hit our goal and we get to sort of like do a big celebration and like an office move. I don't know why, but an office move for me is always one of the like most exciting things. We just moved offices very recently.
That's why you're in a good mood today?
Yeah, except we had to move to the wrong floor temporarily because the tenant, we're subleasing and the tenant didn't move on time. So it's actually kind of an annoying situation. But
so you get to move twice.
We get to move twice. And the joke about it is I remember, I was talking to a new employee and they're like, okay, so when are the movers coming? And I'm like, what movers? We don't use movers. I would never, what? Like we have 80 hands.
Yeah.
We can move so fast if we just move ourselves.
Yeah.
But what I do is I get an invoice, right? I don't actually get the invoice. I don't want to waste anybody's time. But, I got the first invoice and I saw how much this was going to cost. And I said, okay, we can pay somebody else to do this, or we can take the amount of money we would have spent and come in on Saturday and do it ourselves. And then I'll take the exact same amount of money and we'll throw a big celebration to celebrate the fact that the company's growing, that we have this like new space that we want to like warm up and get excited about that. And people, I do like a little survey and people just like, smash the button of let's use the money to celebrate ourselves, which is funny. It's always surprising, but it's the day that we opt to hire movers or we're too afraid of workers' comp or something like that to do it ourselves is probably a bad day for the business. Yeah. In my opinion.
Yeah.
We'll just get better waivers, I guess.
Yeah.
Okay, so we've touched on the sports side, the leadership. There's another side of you, which is the comedic side. We've heard that you have a bit of like an improv. Is that true?
I did a lot of improv in high school and a lot of stand-up in late college and then like pre-product market fit Tennr.
Okay. How do you think the comedy and being on stage and talking in front of large groups has influenced how your ability to speak, go to market, act as a CEO?
Yeah. Well, it hasn't made me less awkward, as you guys probably realized a second ago. But when you say to somebody you do stand-up or something, they kind of imagine, I think, like a Dave Chappelle or sort of like Sam Morril, like one of these guys that like really has an audience and you go and people laugh at the jokes that you say. It's really much more of like a masochistic experience where, in the case of trying to make the company work, nothing was working. So the only thing that you can do that's even shittier than that is to go to a stage and say a bunch of jokes that aren't working and get like not laughed out of the room, like literally, quieted out of the room, I guess.
Yeah.
And, for a time, the whole benefit of that experience is what people don't always realize about sort of something like stand-up is the thing that it gives you is you're always looking for the humor in something. And when the company isn't working for 2 years straight, not many things aren't very funny. So like if you don't start looking for the humor sort of systematically, it just makes things really, really tricky. So that was like the main reason I did it was I was like, I used to have this sort of creative outlet. I wanted to get back to it. I wanted to have something that was like hard, but like short-term, very hard, not existentially hard. You know what I mean? Like you do a set and it bombs, like, that sucks. But it distracts you from sort of the overwhelming weight of failure that I felt for a number of years. Yeah. And then that's a little bit over heavy. This
a little dark.
A little dark for this part of the podcast.
We'll get later.
But it really did evolve to now what I realize is like I basically have like a venture funded stand-up career because I travel to all these conferences and I do these kind of talks. And the message that I want to deliver is clear, but the way that I get people to listen to it is just by trying to be funny. And now like the same talks that we couldn't get into 2 years ago, people pay us to go speak at, and it's because it made the thing entertaining, And so I think I've learned how to try to make something as potentially boring as, as getting a patient from point A to point B. It's like a fun, exciting experience to the people listening. And that's been super rewarding.
Yeah, I think that's a great transition into providing some context for the audience on Tennr and what you guys do, and specifically the founding story and any influence your mom and her role might have on the founding story.
Yeah. Well, I'll talk about the problem that we solve. The kind of key thing is, if you think about a patient moving through the US healthcare system, it's kind of thinking about a box of goods trying to get from one country to the other country, where both countries are sort of evil dictators that don't really want to get it done. And it's like very, very hard to sort of move in through different domestic processes. It's not to say the providers are bad, they're just operating within countries that are very hard to move things within.
Yeah, relevant analogy, yeah.
And so basically, if you go to family medicine doctor and internist and they send out, a patient to get, imaging done. If I'm that imaging business, I'm receiving all this documentation and I've got to basically do a number of things. I've got to prove that this patient is going to get paid for by insurance. I've got to be able to communicate to the patient what they're going to have to be responsible for themselves. I've got to be able to make sure that we're going to have opportunity and space in our operations. I've got to make sure it's all in all of our systems. And I've got to do all of that really fast. Because it turns out if you can do that all within 30 minutes, the rate of that patient that just got sent over to you showing up at the end of the day goes way up. If you do it really slowly, the rate goes way down. And so that's your yield for a patient being sent over.
Right.
So once we were able to prove that, look, if you do this really fast, your yield goes way up and more referrals turn into patients. But what happens is the workload to actually do that process that I'm just greatly simplifying takes so many people, and on average takes 14 days that the patient's even being contacted, because it's just so much work, so much back and forth, so much missing information, so much double checking with insurance. And so what we did was we put the whole process on Rails and really automated it for the recipient. So it doesn't matter how that patient gets sent over. They get sent over via portals, via fax, via email. We're going to automate every single step and do it basically instantaneously with a human just hitting approve and review on the work being done, so that the patient gets a call 30 minutes later and it's like, hey, we already know that your insurance is going to pay for this. We know exactly what your out-of-pocket expense is. Or, hey, your referring provider didn't send over this information. We've already communicated back with them. They're going to send it over tomorrow. And the whole idea is to solve really the black hole problem of the US healthcare system. And I learned about that problem through my mom, who, being in primary care, would always sort of complain in the family group chat, hey, I sent over this patient to an imaging center, and I have no idea where that patient is. It's like I sent them into a black hole. The patient doesn't know where they are. It's like they found themselves in a black hole. And the best thing I ever did in my life is just keep listening to my mom. So we just sort of explored that problem, and I can go into the exact mechanics of how we explored it from there. But that was sort of my foray into the black hole imaging center problem, or the black hole problem by and large.
I think it'd be interesting to touch on the specific ROI that these customers are getting and how you sell the product to the imaging center, because it's really a win-win in multiple scenarios. The patient actually gets to experience the treatment more quickly, which, depending on what it is that's wrong, can be slightly great or really important. And then obviously improves the revenue operations, I'd imagine, of the treatment center. So when you're selling this, what's typically the pitch? Do you pitch specific ROI related to increasing your revenue, or how do you typically convince either your early or current customers?
What's surprising is a lot of times, yes, it's delays that patients experience, but more often than that, it's actually patients just not going to the next appointment, which sounds kind of insane. You'd be amazed at how many people have serious suggested diagnoses for something as insane as potentially a tumor in their brain. And, that patient just doesn't go to the next appointment because weeks go by and they presume, oh, it must not be that serious, right? I'm not being contacted by the place that's supposed to do the imaging for this part. I keep kind of talking about imaging, and I don't want to just talk about imaging, but you get the point.
Yeah.
In terms of how you actually sort of go about, people say, right, that people either buy products to create more revenue, to save more money, or to, reduce risk. So I said, well, we should make sure we can do all three. The first thing is make more revenue. So the number I look at is a yield or conversion. So for every patient that you receive, how many of those patients actually turn into a claim that you're going to actually see? And you can see just these dramatic yield increases when you're running an operation that you guys are sort of in the industry. Let's say you have a potential customer for me and you send that customer to me and I don't respond for 2 weeks. The odds of them becoming a customer of ours goes dramatically down. Right. Now, if somebody comes along and says, Trey, I'm going to make sure that person gets a world-class experience same day, the odds of them becoming a customer goes way up. And that's what we've been able to show for the patient experience. So that's how we show revenue generation. The other way we show revenue generation, but it also hits on the risk side of things, is if you don't do the reason it takes 14 days is because people are trying to cover their bases. They're trying to do the work correctly. If you don't do that work correctly, two things happen. One, you get denied by United, Aetna, you get the point. Like, you make mistakes, and those mistakes lead to denials, and then patients, and then ultimately the provider's not getting paid. The other thing is when it's Medicare, you're getting audited, which is like sort of the risk factor. And if you're doing work and you're doing it sloppily, the government is going to come back. They're going to take back their money. And frankly, so is the commercial payers if you haven't really like crossed your T's and dotted your I's. And the third thing is, of course, on the cost saving side. And this is, I think, the point that people always latch themselves onto. They think like they sort of only measure it by, hey, this is like the rare moment where software is actually like taking the number of people down for, a serious side of these people's operations significantly, 10-1 on average. So people really like get obsessed with that, but it very much is always like the third thing to talk about for a variety of reasons. But yeah.
Now, a quick word from our sponsor. Laura and I are thrilled to announce a partnership with Grata, an intuitive deal sourcing and diligence platform. Keep missing out on private market deals? Ditch the Rolodex and get Grata. Grata's AI-powered platform provides accurate data, deep insights, and time-saving workflows that help get more deals done. And it's trusted by over 500 firms and 3,000 deal makers, including myself. I've personally used Grata in both my deal sourcing and diligence workflows and would recommend their tool to any investor across private equity, growth equity, corp dev, or investment banking. We've negotiated a special offer for our audience. Mention PartnerPath to the Grata team during sign-up, and you'll get free executive seats for your partners and MDs included in your subscription. Now, back to the episode.
Obviously, with your personal experience and it sounds like exciting family group chats that talk about this medical documentation issues. Yeah. But it is really an admirable mission that the company is really pursuing, trying to improve care for people across America. How important is that goal to the DNA of the company and the people that you hire in your interview process?
This is probably going to be like a super edgy answer maybe, but one of the sort of the things you realize about health tech in general is it's usually technology started by healthcare professionals that kind of parlay their careers into technology. And it's not any shade, there's been some great technology built that way.
Yeah.
But a lot of times they're so sort of pie in the sky that they start acting like nonprofits and not focusing like fundamentally on helping the businesses run and build the best technology. We recruit a lot of engineers from Stripe, from Palantir, from Google. Those, engineers are not usually like the most, pie in the sky. Like they are interested in this problem because it's a fundamentally interesting and very, very hard problem to solve. And I think a lot of them would be close to as excited just because of how interesting it is from a technological standpoint to build the models the way we built them, to set up the integration networks the way we set them up. Even if, to be honest, we were moving like beverages. It is this insane ikigai, though, that we get to have people whose skill set is so aligned with something that is so net positive for the world.
Yeah.
I frankly just don't harp on it too much because I think it's this like incredible added bonus that this interesting work with interesting people we get to do also matters a lot. But I feel like what you see more often is founder types kind of abuse those notions and pretend that they're saving the world instead of saying, look, we have a really important problem to solve. This problem deserves to be solved. And you can derive your motivation from solving it by talking to patients that have been impacted directly, which is the case for a lot of our employees, or looking at the fundamentals of how we've gone about solving in the technology and being like, this is just freaking interesting with the way that we solved it. And I don't want to tell people where to drive that sort of meaning or excitement, but I will definitely make them known the impact. I will definitely make sure it's known the impact on that side of things.
And I'm sure it's like a pretty fragmented market to try to reach these specialists probably all over the States as well.
They all
as
listen
beyond.
to this podcast, so that's why.
I mean, the inbound will be insane after the episode drops. But how do people find Tennr today? And when you guys started, there were far fewer healthcare AI automation type companies, but now I'm sure you've seen quite a few more players pop up.
You'll sort of notice, like, we find them, right? And we will deploy an army to go get them, and we will deploy a larger army to go make sure they're successful. There's no strategy, at least that we're running, that depends on sort of hype, that depends on people solving this problem and just using us as a tool. Like, we will solve that. We will solve the problem. We will make sure they know about it. And we will make sure they know the cost of their business for not solving it. That's a way of saying, basically, we run a pretty aggressive outbound machine, and I'm on the road constantly. It's just the nature of the game. Most of our customers don't have time to browse sort of catalogs of tooling and try things out. And, PLG means something entirely different to these guys. They want a solution to a problem they didn't even know exists. And so we've sort of taken it upon ourselves to go make sure they know it exists and make sure. And frankly, that means we'll do a lot of education for those competitors that you talked about. And we don't really care. Again, one of the things that I do harp on is that the problem needs to be solved. And if I'm able to solve the problem going to DC and sort of mandating and making a solution that just works for everybody out the box, we will do that. And if a competitor comes along and solves the problem better than us and beats us in the market, I hope they do that. And if they figure out a way to run a better sort of inbound or outbound generation machine, I really do hope they do that. The problem does need to get solved. What fires me up is that I just see such garbage technology being built left and right that I'm just very convinced that if we do not do it, I have very little faith in other people amassing the tech talent that we've been able to make the solution work right.
Do you see pushback in technology adoption
from sort of healthcare providers?
Yeah.
Well, I think people, I came and joked in this office and I said, damn, that's right. Capital allocation is the greatest business model on earth. Maybe the second greatest business model on earth is is B2B SaaS to a particular type of customer that adopts really quickly, that has really nice NRR and
cursor,
a cursor type, right? That has really nice stickiness. And I would tell people, just so you know, we are not cursor. This is hard mode on everything. The integrations are hard. The customer acquisition is hard. The implementation is hard. And the enemy is always on the inside. If we fail, it's going to be from internal execution risk, which is just more my style. So I love it. You know what I mean? There's not going to be somebody that suddenly this business is, if they do, it'll because they close a Kaiser Permanente or a Sutter Health or something like that, in one go. But that doesn't mean they have the machine to capture the long tail and really solve the problem. But basically, yes, is the answer. It is really, really hard. And I think that's why there's a lot of opportunity, is that it's borderline impossible. Sometimes how it feels, which is what makes it so exciting when we do pull it off.
It's a big market, to be fair.
The big market. It's the biggest. The biggest in the US, at least.
So let's go into the tech side. You have RaeLM, which is your proprietary vision language model trained on over 4 million medical documents. And we've heard that it's the highest performing document reasoning model in healthcare. Very impressive. How did you think about building this model? What does it look like in practice? Is this a sustainable competitive advantage, or given that the tailwinds of these LLMs are getting better, everyone's able to reap the benefits?
I think there's all these sort of dynamics where it's there's a team of people that need to make sure that RaeLM continues to be a serious competitive advantage. We don't lose bake-offs. I'll explain why there's technological gaps to the foundational models as they exist at present. But basically every other team in the company needs to operate that whole side of things will be completely commoditized. And the reason people will stay is it's a workflow that solves their problem. They use it every day. They're completely, obsessed with us and know that we're obsessed with them. But the fundamentals there is that I feel like we had a really good insight to, as language models were kind of becoming more popular, that the data that you use matters. I mean, it's why these data labeling companies are really the ones to talk about cursor, but go look at these, any company that's in the data labeling supply chain. I mean, it's incredible to cost to catch up to us from a data labeling perspective on specifically qualifying medical documentation, specifically extracting the long tail of medical criteria, is something like $180 million just at present. And that number goes up every single day. That's how much you would have to pay these data labeling companies to catch up. So when you consider the data set that we're focused on, we just have such a focus advantage where we don't need to frankly hire PhDs to describe, this is obviously where, the data sets for OpenAI has to go. They have to, if you want to get PhD level sort of support, you need to provide PhD level data. We don't need to do that. We need deep nursing data, and it needs to be labeled in a very particular way that frankly none of the EMRs stored their data appropriately for this type of task. And so I felt like we had a good sort of insight that as long as our niche was focused enough in the data that we recorded and too expensive, it's simultaneously now I think too expensive for a lot of new players to get a really good model that does this. We still get all the benefits from open source foundational models improving because we can tune on top of our data set. And then that's where you get this really incredible performance.
Do you have to tune for each customer?
No. So for RaeLM particularly, you don't have to. For something this is going to be really over the top, but for something like document classification, it turns out if you go to two providers that do the exact same thing and you say, okay, which one is clinical notes and which one's chart notes, right? They will say they'll swap individually and they'll be but listen, you're going to break everything if you call one of them clinicals, right? And when it should be charts, right? So you literally actually do have to do the sort of last mile of document tagging and page tagging per customer, but that happens all under the hood. I don't think most of our customers sort of even really appreciate that, to be honest. That's but this is the thing of I don't think RaeLM actually wins us deals the way people assume. It just makes customers happier because I think a lot of our customers don't have the time to be reading up on sort of the latest and greatest, approaches to building models. And so I think a lot of times they just have to ultimately trust that we're doing the best work for them,
And is the accuracy they expect from something really close to 100% because of the high stakes industry?
Yeah. And the reality is also a lot of competition like tries ChatGPT, like, and they just educate the customer and they come over to us because it just doesn't work, to the point that like there's some weird sort of valley where if you're trying to automate a task and you have like a 3% miss rate, and so you're able to tell the user, okay, you're approving, we're going to review 10% of the work because that usually encapsulates the 3%. The 10% of low confidence work encapsulates the 3% of misses. You get insane advantages, but as soon as you're like 70% accurate, 80% accurate, like it just falls off a cliff, and now you're better off doing it manually.
Yeah.
I don't know what that is, but for high repetition work, it's just like there's a threshold. There's a threshold. And like I know it because we turned the corner on it, where I felt like we used to provide no value to customers, and now it feels like we provide immense value. It was really on like RaeLM 2.0, where it was like, okay, now this is really good.
I'd love to hear you riff a little bit about brand positioning and creative marketing. So I actually have a few friends who work at Tennr and have mentioned that at conferences, people are either dressing up as cowboys. Sometimes I noticed a couple of people on LinkedIn have cowboy hats on in their LinkedIn profile picture. And I think that's a really interesting positioning. I'll let you riff on it, but I think it's around being a cowboy in the healthcare system. And then I know you also really try to avoid mentioning AI in sales conversations. Particularly, I think I heard at a certain conference, if a potential customer or someone who came up to the booth heard one of the Tennr sales reps say AI, you would actually pay them out in cash, and they'd like try and trick the A's to say AI. But if you take a step back, those are very oriented towards brand positioning and kind of this creative marketing element. So I'd love to hear a little bit about the root cause or interest in doing something like that.
Basically, I grew up in like the heart of Silicon Valley, went to school with all the, we were all Silicon Valley kids. And, sort of Silicon Valley TV show is just pie in the sky, bullshitters left and right.
Yeah.
And I hate it. I was the worst sort of like pre-seed seed fundraiser out there. So now it's like ironic to me if I get asked like, hey, can I chat for you about fundraising? It's like my advice for fundraising is I was a horrible fundraiser when the company wasn't good. And now I'm supposedly a good fundraiser. It's just like, no, the company is just good now. It didn't used to be good. Now it's good. I can't do the like pie in the sky, we're all going to be trillionaires and life is incredible type of stuff. And part of that, I think, is an allergic reaction to growing up around it and seeing it and just hating that. And so the story here is my dad was a lawyer when he met my mom, and my mom's family's all Cowboys. Literally, Steinbeck modeled the Cowboys and Of Mice and Men based off of Del Garlinger, my great-grandfather. And my Uncle Gary, basically, when he went to meet my dad, he said, so you're the lawyer? My dad goes, yes, great to meet you. And sticks out his hand, he just spits on the ground and walks away. My point is, I think that there's there's kind of like this two minds in me, I guess. There's this like sort of dreamer Silicon Valley type of stuff. And then there's the like realist disputes can be settled with like sort of shaking each other's hands and moving on with the day, which is like what, Uncle Gary would tell you.
Yeah, or arm wrestling.
By the way, we're not in contact with Uncle Gary anymore, I should say. He's kind of off the ledge, but so that's actually totally fine. But I think, though, to be honest, part of this came from like, we are not going to let anybody tell us that, AGI is going to solve all of man's problems. And, there are these geniuses working, at these companies that are going to build this like quote unquote AI systems that are just going to hand wave you away, save everything, and everything's going to be solved. To me, that's like the lawyer, and we're like Uncle Gary, which is like, nope, we're going to have to still like wake up tomorrow and solve our own damn problems. And you should just realize those guys are marketing to you to get their hours up. And so now, which brings me to the final point, which was, why are our sales reps and really the whole team discouraged heavily from saying, those two letters? It's, if you're kind of a lawyer and you know the law, you get the opportunity to take advantage of the cowboy, or of like sort of maybe somebody working the farm. And it's very much like the right way to go about things is to not use that, to not start hand wave. There was a time period we could have said, we could just plastered AI and everything. We would have 3x our inbound, sold more deals, been on a bunch of innovation projects for bigger companies.
Yeah.
And we were like, no, we just refuse to do that. We have to solve a problem for you that you believe is worth solving. We have to be on your operational budget. We're not going to be on R&D innovation budgets. We're not doing that. We're not playing that game. And it's helped now because it forces discipline with sales reps. They have to talk about the models. They have to say RaeLM and talk about how RaeLM really works. And it's also like hopefully the intention behind it is it forces people to like never feel like they're pulling the wool over the customer's eyes or using some like advantage that they have because they get to market something that's hot or buzzy. And the final thing is with churn and things like that I project a lot of people that have said AI through or the future of this or future of that, and everything's changing, and we're God's gift to earth with our new crazy AI this, AI that.
Yeah.
I think they're just getting a bunch of like low-hanging fruit experimental buyers. I'd much rather like talk with somebody about yields, denial rates, and employee drag.
Where the rubber hits the road.
Where the rubber hits the road, and force ourselves to sort of reckon with that. Don't want to be an experiment to somebody,
Yeah, I think that's fascinating, and I love the analogy to the Cowboys as well. I also want to bring up another interesting story that might be slightly contradictory to the last point that you made, but it's around the Garden of Eden and the OpenAI office in San Francisco, and trying to understand, I think the story, I don't want to butcher it and I'll let you tell it, around why OpenAI, the office in San Francisco, has a Garden of Eden, and the idea that they're potentially summoning God through a machine. And I think the broader point is they're really overselling what they're creating. Obviously, they have incredible products. I'm not trying to diss OpenAI, but the idea of overselling is incredibly important in startups, right? You're building the ship as it sails. And so, one, I'd love to hear you kind of riff on that story quickly. And then two, how has that impacted your view on all of this, and to be more of a realist and focus on where the rubber hits the road?
The sort of quick and dirty of the story you're alluding to was just talking to a friend that when I was trying to like, hey, what do you think's next for the company? And like, what are you guys really doing here before ChatGPT? And they're like, Trey, we're going to summon God from a machine.
Yeah. And she's at OpenAI, right?
Yeah. And I thought that was like pretty sweet. At the first point, I was like, wow, that is like a baller mission. And, it's sort of ultimately incredibly bold. And the reality is this is like probably, ChatGPT is probably one of the most like sort of valuable tools, period. But it's not God. So if you're already one of the most valuable tools, like how do you get even more buzz? Like how do you oversell what is already an incredible tool? You have to take it to the next level. You have to talk about the fate of the world, doom, like how everything's going to be taken over. And you can really capitalize on fear. I mean, it's just, I'm not saying anybody's explicitly playing a sort of fear-based playbook, but I'm just saying if I wanted everybody to talk about not the fact that it actually performs at like sub 60% benchmarks on like most real like industry use cases, but I wanted to talk about like how like don't look away at that. Look at like how it's going to take over the whole world. I would definitely play this sort of fear-mongering playbook as opposed to like this scrutinizing like it's strategic overselling to basically distract from very obvious sort of like misses that, you'd obviously rather not talk about, right? And I think it obviously hurts to sort of like, I don't want to harp on this too long, but one of the things like, cause I know, a number of founders sort of like talk about this, which is like, or a number of founders maybe listen to this. And it's like, one of the things that I kind of caught on to when it was 2021, when everybody was into crypto and we had VCs trying to convince us to go into crypto. And I was like, I'm not going into crypto was we'd have people our age telling us how, you're building in Web 2. Are you kidding me? Like, there's no opportunity left in Web 2. And it harkens back to like in the 1970s, everybody sort of told like Warren Buffett, like you're doing value investing, like the market is efficient. Like, and he would say that there was no greater like boon to his career than everybody else assuming it wasn't even worth it to try. And these moments sort of happen, like I've now seen two of them, and I'm sure there's been way more of that, where crypto, where it's like, no, like Web 2 is dead. You should only be building on Web 3 or you're like wasting your time. And I was like, okay, we're not going to do that. Let's just keep trying to solve a problem. And then now it's been a lot more of like, AGI is right around the corner. You're wasting all your time if you try to solve anything that these like super intelligent systems are going to solve automatically. And it's like, honestly, once again, great. I hope everybody believes that you don't need to hire engineers anymore. I really, really hope that people think that you can be 5 people in a basement and get to $1 billion of revenue. It's going to be true for some people, but I really, really do hope the majority of people like that are going to compete with us operate with that belief, because I think you're going to be wrong. I think it's going to be a great opportunity for the people that are like real.
How do you think Tennr, the impact on the patient journey today, what will it have in the next decade? If you could hop forward 10 years and say, okay, now we've defined the patient workflow, this is what it looks like.
I think sort of the broader point and like going, like there's so many companies that are just like selling the system, these like $4 million exploratory like healthcare AI projects. And we'll just get in there, we'll solve something. What I haven't really seen anybody else do is lay out, and obviously we don't like to do this externally, but we've laid out every single action that is done and performed within the sort of healthcare experience from a patient's journey. And it really encapsulates almost everything outside of sort of like HR and, important tooling around that stuff. Mm-hmm. And systematically, you can remove the reasoning steps and augment the ability of the human to do every single one of those steps. We focus on the pre-visit patient experience, because it's one of the most high leverage places. You can get patients better access, you can get patients there faster, you can impact the receiver's revenue, you can impact their denial rate. And it's allowed us to really wedge in a really important problem. But systematically, we are going to go and do every single thing that comes before and after that. There isn't much before, but there is a lot after. And we are always going to play friendly with EHRs. We think EMRs are always going to like be a foundational place to serve as sort of the system of record, sort of database for these providers' businesses. But there's so much work augmentation that can be done with how like these businesses interact with them. And I think basically to play it very simply, you will go to the doctor for a headache. And hopefully this is not pie in the sky. This is just like what's literally going to happen. You'll go to the doctor for a headache. The doctor will sense that something is like potentially seriously wrong here. They'll refer you to go get a CT. You'll be contacted by the CT the same day. You'll know exactly what your patient responsibility is going to be. You'll know exactly when you're booked. Hopefully it'll be the next day because you can run those ships so tight that a lot of times the paperwork is the bottleneck. You'll get seen the next day. The information will automatically flow back into the primary care that sent you. They'll say, okay, you got to go to a neurologist. They'll send you to a neurologist. Once again, you'll be contacted the same day. You'll know exactly what it's going to cost you. You know exactly where your insurance is potentially like haranguing you a little bit, but all this supplementary information will be communicated back and forth. You will be diagnosed, you'll be prescribed for maybe a rare specialty pharmaceutical, and that information will get sent from the neurologist to that. You'll be contacted same day and you'll get all the information. And basically you will have like access to life-saving treatment sub 8 days, end to end in the journey. That scenario that I just described for you, which I could go slower on, is typically an 8 to 12 week process. So, you could have a very, very late stage, serious issue progressing as you bounce between specialists and bounce between prior auth delays and missing information to prove medical necessity. And, we can't prescribe you that drug because you haven't actually done step therapy on a cheaper drug. And you know what, actually, frankly, if you're going to get, something related to your spine, when you see you do PT for 3 months, well, it actually turns out you did do PT for 3 months, but the orthopedics didn't have that documentation. And so it'll be this like great efficiency. And it's efficiency that we're banking on coming through the facts, right? Like it's still going to be unstructured flows of information. We're not expecting anybody to change it. We're just going to solve the problem with like the hand we were dealt. That's what I think is going to happen.
And depending on the problem, the medical issue, it can literally be life-saving for a number of folks. And you almost make the argument you're summoning God through Tennr.
I wouldn't make that argument.
No, I'm kidding.
No. Yeah.
So you mentioned who you play friendly with, and this might be, you don't have to answer this, but you can if you want to. Is there anyone who you don't play friendly with?
Well, it's a lot of physics if you do the math. It's very obvious who benefits from patients getting seen faster and providers getting paid more for the service that they do. Like, just go figure out who makes all their money from those two things not happening, and you'll figure out who we will absolutely impact.
Before we wrap up, I think it'd be interesting to get your view on the insurance industry, given you guys obviously impact reimbursement rates for providers.
Well, that's frankly like one of them, right? The reality is that we're doing all this like documentation work, and we've had a lot of payer in because they're like looking at their providers and they're saying like, what the hell happened? This person, used to have a clean claim rate of like 60% and now they're at 98%.
Yeah.
And then they want to use us for other things. Most of the time we say no because we got to stay focused. But, what they're usually asking us to do is to be on the back end to do their denial work because what they receive is also fax information to prove medical necessity. And they also have to hire nurses. So somebody is going to fill that market need. And, it's a great debate of ours. Do we want to play both sides of the aisle or do we want to only serve providers? It's a bit strange to be building models and potentially both sides. Right now, we're only on the provider side and like arming the rebels to sort of defeat the empire is sort of how I frame it. But then you realize actually a lot of these health plans, frankly, look all that's like the empire and honestly a lot more like good people trying to like help like, populations that it's very difficult for them to get care and they're really trying to do good work and they are always, getting abused and and dealing with a ton of fraud, waste, and abuse. But anyways, to kind of get to your question, like there's going to be a complete and utter arms race where the unstructured documentation proving why a patient needs the expensive pharmaceutical is going to be battled by a model on the payer side proving why, no, in fact, they should not. And this side gets to control the guidelines and the inputs to the model, and this side gets to adapt. And it's just going to be a like arms race of people like, by the way, this arms race is already happening with humans. That's why there's so many admins on the billing side and there's so many admins on the payer side. Because they're all just competing to out-maneuver each other. And the race is now like there's a new weapon involved. It's the model.
Yeah.
And the models are going to be used. And we knew United was using a model because we can deterministically say when all of something is checked. And we could see that they were like tweaking things ahead of time that were not in line with their guidelines. And we can tell you when Medicare Advantage plans are doing the same thing when they're not following Medicare guidelines.
Yeah.
So we knew that they're all doing this stuff. They're playing with it themselves, and they're using different software providers. And there's going to be software providers that make insane gobs of money selling to payers to do the opposite of what we do.
So on the Rebel side, is there data advantage to working across so many providers that are submitting claims? Are you able to adjust the claims to counter to the adjustments that United and those models are making?
Not nearly as great of an advantage as they have, because they can change the guidelines. So they can change the underlying inputs to the model, which is a much greater advantage. And so they'll always have the sort of like edge, the house edge, if you will. That's where, like when we talk about sort of government stuff, like where the government needs to sort of step in is when you're managing a patient as a payer that's supposed to be covered under Medicare guidelines. We have all sorts of examples where payers are not, in fact, dealing with situations according to Medicare guidelines. In fact, they're like very clearly running with their own guidelines or their own models or what have you, or basically discriminating on patients as they see fit, not as Medicare sees fit. So I don't know. I think it's going to be very ugly. I think it's going to be very interesting.
How difficult is it to say no to a customer that wants you to help with a different problem that might be outside of your direct purview?
Well, when we didn't have a very good business, luckily they weren't coming to us when we didn't have a very good business.
Yeah.
And I didn't know I think there are a lot of companies that I won't name that like have figured out that you can make a lot more money basically figuring out how to take a patient population that you already have, adjusting all your documentation to get the government to pay you more for certain plans than you can actually solving a problem. And it's a really tough incentive to sort of deal with. And we're just probably not going to do it.
Yeah.
Like, we're probably not going to do it. The good thing is none of these things, they don't fall out of the sky. You know what I mean? There's enough people selling to those people that want to do that. And just look up HCC scoring and see what tech companies are advertising for this use case. That I don't think we really have to. I think we can just like keep our heads buried into the sand and be altruists, I guess. And maybe we'll lose a lot of money in the process. But we got a mission. We got to solve that mission. If we don't stay on it, nobody else will. It's sort of a fundamental belief that we have.
Yeah.
Focus.
Yeah.
Should we end with a quick fire round?
Let's do it.
What's a trend in healthcare you're excited about?
I actually really like Hippocratic's use case of like nursing calls and sort of like helping patients with the phone. I think people picking up the phone more, whether it's like automated or not. I just hope that when they pick up the phone, it's really good. If that's that's something I'm really excited about if it works, because that's something we don't solve that I'm very sad about because it's a horrible experience.
If you could go back and change one thing upon starting Tennr, what would it be?
If anything.
Well, I probably could have saved 2 years of my life by making my calendar all about talking to prospective we've been at this 4.5 years, and I look at my birthday week for the last 4 or so years, and it's like no customers in the first year, no customers, one like investor meeting in the second year, and then like 30 in the third year, and everything started to work, and the fourth year is the same. So just talk, and it's the classic advice, but if you don't feel it, you'll never do it. So I would have just started doing it right away.
And then who's a founder you look up to?
The way that I try to describe Tennr is very similar to Ryan Peterson's Flexport description, which is getting a box from point A to point B. It's like getting a patient from point A to point B. So definitely him. Actually, the bastard was supposed to be at a dinner where I was going to get to meet him, and then he bailed at the last second, so I bailed too. But anyways, I got to chat with him during YC, and it was like really funnily. Like I like honestly, I really clicked with the guy. He has no idea who I am, but I really liked him, and I still look up to him.
Maybe someone can tag him in
Please.
this post.
Yeah, definitely.
Great.
I don't think we're like worthy of him acknowledgement yet, but we'll get there very soon.
Yeah, I wouldn't say that. Yeah, you guys are obviously doing incredibly well. If you haven't checked out Tennr, obviously definitely check it out. You guys have an incredible product as we discussed today. So Trey, thanks so much for coming on.
Thank you guys for having me. Really appreciate it.
Thank you.
Sweet.